Okay, so welcome to today's talk. I want to talk to you today about a particular kind of pattern that we are seeing in today's generation in children. We are going to talk about adenoids. These are often like a lymph gland swelling, which are located in the roof of the mouth. And what is important is that this happens so frequently in children, because of which there is like a nose block, there's difficulty in breathing, children keep on getting cough and cold, and the pediatrician asks you remove the adenoids, and that's the worst thing you'll do for your child, to actually operate or remove your adenoid or remove your tonsil. Because what is adenoid is basically a gland which produce immunity cells. So when you actually remove it, the child's immune system is going to go down. This is why the best healing for the child is homeopathic treatment. Homeopathic treatment at a long term level helps reduce adenoids, helps reduce the symptoms of adenoids, help increase the immune system, help improve the recurrent cold, cough, and developmental issue. And I have many cases of adenoids, and remarkably, homeopathy has helped. So I want to talk to you about some interesting remedies that I use in my practice, and just some thoughts about it. The first remedy I want to talk to you today about is a very lesser known remedy. The remedy is Agraphis nutans. This is the most amazing remedy for adenoids. It's Borix clinical specific. It's a clinical gem. When you are thinking of Baraita cup, but patient is not Baraita cup, not slow, but very chilly, often unable to hear, but that is mainly due to the adenoids. Recurrent cold cough, deafness, mucus, ear, nose. Think about Agraphis nutans. It's a remarkable remedy. I've used it in 30 potency, frequent, and it shows amazing result. Agraphis nutans. I want you to remember this remedy, my friends, and especially doctors who are interested in treating children and are doing study in pediatrics and homeopathy. Remember the remedy Agraphis nutans. Calcarea iode. So we often give calcarea, but calcarea iode, remember, is a top remedy for adenoids. In fact, adenoids later on in future, calcarea iode children can often even get goiter. One of the main things about calcarea iode is there is a lot of polyps on the nose, and when you see the tonsils, they are filled with crypts. Next remedy, barite iode. So you must have seen calcarea iode, barite iode, maybe magnesium iode. Iodine seems to be a top compound for adenoids. In barite iode, very important, there is a thick, chronic, degenerative, indurated adenoid. And along with that, recurrent infections. Think about barite iode. Next remedy, sorinum. Remember, if no remedy helps you, the child keeps on getting recurrent. The only remedy which can remove that tendency to adenoid, sorinum. Chilly, very chilly child, dirty child, very hungry child with lot of history of skin eruptions. Not better by any remedy. Think about sorinum. Finally, Burnett's best remedy, medorinum, with a history of psychotic miasm. Medorinum we like to call is a night bird. So child who keeps on awake at night, energetic at night. Think about Medorinum with the craving for pani puri, chaat, aloo. This is a top remedy. So think about it, and it's an amazing treatment, homeopathy for adenoids. And the remedies are so many. There is Torula. That's one other remedy that we give. I learned this from Sarkar. Another remedy, Thuja, Basilinum. But interestingly, one remedy I want to remember is Agraphis nutans from this.